This interview is part of Penn's Elevate series, which encourages patients to take an active role in their care to improve outcomes. What advice do you have for AML patients who are seeking to elevate their care?
Well, I think it's important for people to be an active participant in their care. While we recognize that not everyone has medical expertise when they are going through this, it's important that they are informed, that they would like to be informed. It's important that they have a full understanding on what's going on in terms of the treatment, the plan, the short-term plan, and the long-term plan. And so there's a lot of information that needs to be digested. What's important to note is that it doesn't all have to be digested at that very moment, at the time of diagnosis. These are processes. And so what I tell people is that, this is not going to be your only opportunity to talk and ask questions. This is something that we're going to be going through and doing this journey together. And so I think it's important that they become an active participant in that journey, not just with themselves, but also with whomever their caregiver is and whoever is important to them that's going to be going through this journey as well.
I understand that some AML cases require treatment shortly after diagnosis. Is there room for a second opinion? And if so, what are the benefits?
So there often is room for a second opinion. There are times, quite honestly, like you said, where patients have a really acute problem when they come in along with the diagnosis, or that the diagnosis has gotten to a point where we need to initiate therapy as an inpatient emergently. That is becoming less common. It used to be when I started doing this, that if you had the diagnosis of AML, you were admitted to the hospital and you stayed there until you completed your first round of therapy. That's not the case as now. In generally, what we've learned is that there are studies that show that you can actually delay therapy for a period of time in order to make sure that other things are established. Getting a second opinion is very important, particularly at a tertiary care center where physicians specialize in treating these types of diseases. And so I think it's very important to get expert opinions, not just in terms of how to treat the disease, but also diagnostically, and to make sure that the correct tests are run, the correct molecular studies are run, in order to figure out what exactly would be the best treatment for your individual version of AML.